All right, welcome back. So today we're talking about post-COVID brain fog and what you might be able to do about it. Because there's no doubt about it, a lot of people run around with this. So brain fog or a lack of mental clarity, it's one of the most common symptoms related to having had COVID or even other infections like Epstein Barr virus, cytomegalovirus, Lyme disease. But brain fog, it can really mess a lot of people up and even cause them to end up on antidepressants, anti-anxiety medications, taking stimulants all the time, trying to find some way around getting their brain to function in the way they remember it functioning and get this cloudiness out of there. So it's important to recognize that though the inflammatory state induced by the infection, it may have triggered the brain fog and like, whoa, now it's manifesting, never had this before. There are lots of lifestyle choices that can prolong the brain fog, promote it, or actually heal the brain fog. So please subscribe if you haven't already, share it with your friends, as there's no shortage of people struggling with brain fog who could use what I'm about to present. I think it'd be super, super helpful just over the next few minutes. All right, so brain fog is essentially cognitive derailment. It is thinking that has been frustrated, and this can manifest as, planning, organizing, decision-making, taking multiplied times more energy and time than it usually would because executive function is impaired with the brain fog. And in the case of COVID brain fog, there's actually brain inflammation that's developed and is not being cleared. So basically, after the initial immune upregulation to stop the viral infection, or to stop the viral replication, the immune system, it just kind of wasn't able to turn off. And that initial necessary inflammatory phase just kind of keeps going on. So when this happens, we need to use some kind of external means and lifestyle adjustments to support the central nervous system and to support the balance of the immune response. It can also often look like the same thing you would do for like a traumatic brain injury, like fall off your bike and smack your head, or you got punched in the face and got a concussion. So the first thing we want to be thinking about is sleep. You really need to find a way to breathe through your nose at night. If this is a daunting task, then you want to take the time during the day to practice nasal breathing, to figure this out. Often, I bring up the idea of nasal breathing versus mouth breathing, and people are like, okay. I need something stronger, Dr. Matt. That's how I breathe. People think, I don't think the orifice I breathe through is really going to make a big difference here. But what so many fail to understand, and why they just kind of poo-poo the nasal breathing, I think what so many fail to understand, given that so many of us are walking around, staring at our phones with our mouth gaping open, is that breathing through our nose, it literally is tickling our olfactory cranial nerve there, and is causing synchronization of the electrical activity of our limbic system, which is related to the amygdala and the hippocampus brain areas. So nasal breathing, this is a completely free therapy, by the way. You're going to breathe either way, so you might as well put those 20,000 breaths you take every single day to promote healing and that resynchronization of your limbic system. Because the limbic system, that is your autonomic nervous system, that is all your sensory inputs. If that is off, if that is feeling unsafe, the body's going to manifest a lot of symptoms, and you're going to do a lot of blood tests, a lot of urine tests, stool tests, imaging tests, and you'll find there's nothing wrong with you because the limbic system is off balance. So we're not going to go in deep on the limbic system today, but needless to say, nasal breathing is a fantastic way of supporting recalibration of the limbic system and synchronizing it via the tickling, like I mentioned, of that olfactory nerve. All right, secondly, another simple thing. We just got to limit or eliminate screen time. If you got brain fog, man, send it packing, especially the random purposeless scrolling. We don't want to add confusion to our nervous system, to an already inflamed tissue. We don't want to add more confusion, more trauma. Over and over, I've seen patients find themselves, after COVID in a rough spot related to going back to work and having to look at a screen all day. So anytime you can take the rest of your time, and remove yourself from that hypervisual stimulus of screens and the jumping back and forth of surfing the web or social media, you are creating margin. And margin is the space where healing can happen. All right, number 3, SPMs. Have you heard of them? These are called specialized pro-resolving mediators. You may have not heard of them. This would be like a supplement you would take. But these specialized fats derived from essential fatty acids like from fish oil, I have seen dramatic benefits in patients using this who have brain fog, head pain, post-COVID, even acutely with COVID. I use them often to bring the inflammatory load down. So the beauty of SPMs is that they do not block the necessary kind of initial inflammatory phase that leads to rapid viral clearance, because you want to clear the virus as fast as possible, right? Because after all, inflammation is a desirable and natural response to injury or to illness. But like I mentioned earlier, sometimes the immune system, it can't turn itself off. And so SPMs serve the purpose of down-regulating the process and essentially resolving inflammation. I think overall we'd see a dramatic improvement in just the overall health of the population if we would get the millions of people who pop ibuprofen and Tylenol for mental and physical discomfort to start actually using these specialized pro-resolving mediators. Number 4 on my list is ashwagandha. So ashwagandha is an Ayurvedic herb. It's one of my favorite herbs. It has so many positive effects for our fast-paced world. It's very protective of the nervous system. It's been shown to have benefits with both chronic and acute neurological injuries. In fact, there's a 2022 study showed that just 400 milligrams of a standardized extract of ashwagandha improved the measures of executive function, improved the capacity of sustained attention span, and increased short-term memory. Just a single dose, they notice a difference. And ashwagandha, it's one of those very low potential for side effect herbs. It helps with literally adapting to life. So stress and all that, it can be a very helpful herb. And traumatic brain injuries, we use it all the time for that. And what you have when you have, inflammation in the brain is essentially low-grade chronic trauma happening. So I find it very, very valuable. Number 5, so when brain fog manifests and one of the big symptoms is really low energy and just, oh my goodness, mental fatigue, then Rhodiola is another great adaptogenic herb to bring on board. And often with brain fog, people are putting out so much energy all day long, for simple decisions and mental tasks. And it takes so long for them to work through that exact same thing that they get to just, snap right through before. And problem solving is just exhausting. So bringing on, a really strong anti-inflammatory nerve protective herb, it can have really high value. And often people find just a little perk up in their day, like instead of pounding another Red Bull, another caffeinated drink, it's like a little Rhodiola in the mix, support the natural anti-inflammatory, antioxidant pathways, energy pathways, like build your energy up versus just like, throwing another stimulus into the mix. Okay, so like I mentioned, sleep, you got to nasal breathe. No questions asked. Got to get your nasal breathing happening. 2, get that scrolling randomness on the screens. Man, put that to the side. That's good for any of us at any time, just to put that to the side for brain fog. 3 is those specialized pro-resolving mediators. Look into those. I've seen those be very effective. So many studies relating to the anti-inflammatory effects there. And then check out ashwagandha and rhodiola to give yourself that antioxidant, brain supporting, neurological system supporting herbal intervention that is essentially all good and has a very low potential for any kind of side effect, but can be very just uplifting to the spirit. And then one last thing I want to mention is on the subject of brain fog. I noticed a lot of people and patients who are still just like going full steam ahead, not releasing any of their life obligations, not recognizing that when you're in this state, it is actually valuable to slow things down a little bit. release some obligations, allow yourself to heal. That going slower for a season can actually permit you to go so much faster, so much longer, over the long term. And that slowness is paramount to help just clear that fog. So over and over, I see the stressed out individuals are overcommitting themselves and opening the door to brain fog, returning. And so you see the healing happen, like, oh my goodness, I feel like I'm getting better. That's not a time where you want to start just like bludgeoning yourself with all these obligations and putting all this stress on yourself, because the tissue really needs time to heal. This is legitimate. This is like a wound. Just because the scab is over the wound on your arm and you're not gushing blood anymore, doesn't mean that it has the same capacity to withstand stressors as tissue that didn't have a scab on it, that didn't have a wound earlier. So, just like that scab's going to take often a couple weeks to heal up, and now it's back to its solid self. Same with our brain. Just because we remove the inflammation, we say, oh, cool, like, man, that brain fog isn't intense anymore. I'm just going to start, staying up late, forget the nasal breathing, back to, just stimulants and doing my own thing. No, you got to give it some time to fully recover so that you can truly be free of it, and your tissues will have actually healed. I would love to hear, for those who've pulled out, of the hazy thinking and the brain fogness, especially related to, an infectious process. Love to hear your story. All right, I'm Dr. Matt. Talk to you guys later.